You can just tune in this Unica 103.5 FM, the only radio station that offers you information, education, and of course, entertainment 360. My name is Aki Umada. Tell me, Lolo. Today, we are having something very special today in the studio. We are celebrating World Health Day 2025, Team Healthy Beginnings and Hopeful Futures. Right here on the studio, I'm having no other person than a delectable young lady who have crossed and pushed all borders in education. I have no other person than Dr. Praise Andrew, member West African College of Surgeons, senior resident doctor, Department of Obstetrics and Gynecology, UCTH Calabar. Ladies and gentlemen, Dr. Praise.
Good morning, everyone. Thank you for having me.
Good morning, Dr. Praise. Yeah. You sound so cool and so soft. How are you feeling this morning?
Fine, thank you.
Thank you for honoring our invitation. Thank you. So, so far so good. How long have you been in this obstetrics and gynecology?
Oh, thank you very much. So I've been a resident doctor in obstetrics and gynecology for about 7 years now. Yeah.
So let's begin with a broad view. What are the major maternal health challenges women in Nigeria face today, especially in undeserved communities?
Thank you very much. Women in Nigeria, especially in underserved communities, they face a lot of maternal and child health issues.
Okay.
And topmost among those issues are limited access to health facilities and infrastructure. We have a dearth of health facilities. They have poor access to some of these facilities, poor transportation system to help them run when there are emergencies. We also have the issue of poor education. Women still don't know how to take care of themselves when they are pregnant, and this has led to a lot of mortality. Nigeria still has a very high mortality rate of about 576 per 100,000 women. And that's quite high because the WHO aims to reduce and hopeful future in regards to maternal and newborn care. We hope for a world where women shouldn't die in pregnancy and children, newborn and under 5 children, shouldn't die in their infancy. And so this is to bring about advocacy, to bring about a reduction in the statistics that I've mentioned earlier.
Yes,
and so that's what it means for us, that healthy beginnings, we have women staying alive, giving birth to children, and that's marking a beginning in their families. And then these children also stay alive and don't die in their infancy and child age. And so that's what, in regards to maternal and child health, the WHO, World Health Day, Healthy Beginnings, Hopeful Future. We want to have a hopeful future where women stay alive.
Yeah.
They are armed with the right information to make proper choices and decisions regarding their health.
Okay.
And therefore, they stay alive to have these healthy beginnings. And then we have a hopeful future where we have a reduction in maternal mortality.
Splendid.
Thank you.
That was just splendid. So, how can teaching hospitals and academic institutions like Unica and UCTH play a transformative role in maternal healthcare policy and delivery?
Thank you very much. So, teaching hospital is a tertiary health facility, and the university is an educational environment. So, how they can contribute to help in maternal and child health is by ensuring we have continuing health education for the existing workers. We have the health workers, nurses, doctors, and then even the upcoming ones, the younger ones, the medical students, nursing students, and other health practitioners. They have the proper education so that they can come up and do their bits to help to save mothers and children in particular. And collaboration with interprofessional departments. We have sections, more to invest in maternal and child health. This will go a long way to improve maternal and child health. Yeah.
Wonderful, splendid. Right here in Unicorn 102.5 FM, you've heard Dr. Precious giving her statistics on what World Health has given for this year, World Health Day. She has given her pep talk and TED talk on collaborations with the university and the community at large. So we're going to go on a very short break, and I'm going to play you something from ASA again. Like I said,
for the people who are God, yet for the ones not yet born. Oh, for the people who are for the people, peace. For the people who are gone, yet for the ones not yet born. Whoa, for the people who are for the people. I cry when I see that I am burned. I leave when I see what I have to do. That's what it's all about. Are you sitting there looking at me? Just take one step at a time. Cause if you jump, you will never believe the birds of life. Am I wanting and waiting for me and you? They make your brother say, I want to run away. Run away. Run away. Where does he go? Run away, run away, run away. Where does he go? For the people who are gone, yet for the ones not yet born. Whoa, for the people who are for the people. I cry when I see that I am burned. I leave when I see what I have to do. That's what life is all about. When you're sitting there looking at me, just take one step at a time. Because if you jump, you will never believe the burns of life. The man wanting and waiting for me and you. The big better say, I want to run away. Run away. Run away, run away, where does he go? Run away, run away, run away, where does he go?
For the very best in music, information, entertainment, and education. Stay locked onto Unicool Radio International, 103.5 FM.
15 minutes past the hour of 10. If you have just tuned in, this is Unico 103.5 FM, the only radio station that offers you information, education, and of course, entertainment 360. Today, on the educational sector, we are celebrating World Health Day 2025, themed Healthy Beginnings, Hope for Future. Right here in the studio, we have Dr. Praise Andrew, a senior surgeon from the University Teaching Hospital. Miss Praise.
Yes, thank you.
It is such an honor to have you in the studio. Thank you. Thank you. So, well, we're just discussing about the statistics that World Health gave about child mortality, and I'm also talking about the Japan syndrome and give us tips and head just about everything we're asking about World Health Day. So, we are moving forward. Why is preventive care so critical in reducing complications during pregnancy and childbirth?
Thank you very much. So, like they say, prevention is better than cure.
Okay.
And this applies also in reducing mortality in maternal and child health. Preventive measures are very important, and this could help to identify women who are already having pre-existing health conditions before pregnancy. Some women may not even know they have hypertension or diabetes before pregnancy, but when they employ these preventive measures, this can be picked, and then they can be effectively managed to prevent complications that could lead to death in them or the baby. And then even within the pregnancy, preventive measures entail identifying these women. Some women develop problems within pregnancy. A woman can be normal all through pregnancy and then develop what we call pregnancy-induced hypertension, preeclampsia. And like I told you earlier, this is the major thing killing women now in pregnancy, hypertensive disorders in pregnancy. Some women develop it within pregnancy. And so if they are not taking preventive measures like going for antenatal care, they will not be identified. And by the time they are picking it up, they are almost dying. They're already in the bad stage. And so that's why prevention is very important. There are medications we give pregnant women. If they don't come to the antenatal clinic per se, they won't get these medications. And some of these medications are to help prevent even complications in the baby.
Yeah.
You understand? And when they don't take these medications, when they don't take these preventive measures, they end up having complications in the baby or in their own lives. And that's why preventive measures are very important. They go a long, long way to reduce maternal mortality and even infant mortality and morbidity.
Well, you have heard it from herself. Dr. Praise Andrew have said it. Pregnant women should always go for antenatal. They should always keep up with their medications. They should always go for monthly checkup, because even after the whole trimester, when they are close to the end, and the complications just come up on its own. So how is digital technology like mobile health and telemedicine helping to improve maternal health, and what's its potential for scale in Nigeria?
All right, thank you very much. Like I said earlier, we already have a dearth of medical personnel in the country, a lot of people leaving, and so we have few medical practitioners to attend to the millions of Nigerians. And then we even have people in rural areas where sometimes they don't even have a medical practitioner there to help them. And that's where telemedicine comes in, where you can have access to skilled health professionals over the phone, and they can listen to their complaints, and then they can provide basic solutions that can be found within their environment, and can also give them that information they need to say, okay, this is beyond your environment. You need to move to the next health facility for emergency care. And that's when the role telemedicine comes in. Also, telemedicine is important to gather data on what's going on, because I gave you statistics of 576 per 100,000. That can't be possible without telemedicine, where we can get this data and then we can feed it into the appropriate channels where it can help to influence policies that could help to significantly improve maternal child health. So that's how telemedicine can really come a long way to help in helping our women and their children.
Digital technology helped to accumulate the data of 576 per 100,000, which the World Health now holds up for a community like the communities in Nigeria. Maternal health doesn't stop at childbirth. What should our systems be doing to support mothers' long-term health and well-being post-delivery?
Thank you very much. So post-delivery, mothers still need to be supported.
Okay.
Mentally, physically, emotionally. And so this goes a long way to help ensure especially new mothers, they enter into motherhood on a soft landing.
Okay.
And it's important that even our primary health facilities should be aware of postpartum health care, and that will help so that women who cannot go to these big health facilities can also access care in their primary health centers. It's important. There are some women, like this hypertensive disorders in pregnancy I told you about.
Yes.
Some women develop it after childbirth.
Oh.
And so if they don't go for checkup, if they don't recognize the symptoms, the signs, they could. I heard about a woman who just delivered and just slumped in the house and died.
Oh my God. So even after the first trimesters.
Even after all the time.
Yes.
To be checked because they could still develop some complications. Some need a lot during delivery and they have to be checked postpartum to ensure that they recover optimally after delivery. So some women go through a traumatic birth experience and depression and all that, and it's something that is not really talked about. And so it's very important that women are supported, especially with mental health awareness and seeking for help when there are issues. And that will go along with the delivery process to ensure that women are stabilized to be able to care for their newborn and also their families.
Wonderful. Well answered. Thank you very much, Dr. Price. Well, finally, on this World Health Day, what message would you like to share with health workers, policy actors, and expectant mothers?
Thank you very much. Like we said, today's World Health Day. Healthy beginnings, hopeful future.
Yeah.
And for the health workers, you're doing all you can despite the we have at our disposals, and we want to say we see you and you're doing good. So
you're doing wonderful.
Continue what you're doing and even do better. For policy makers, we want them to look more into maternal and child health, because that's where the beginning of society is. When you lose a mother, you lose a family, you lose a society, because mothers are very instrumental to the society. And so we want to join policy makers, our governments, institutions, to make sure they do all they can to bring about policies that can improve maternal and child health. And then for the pregnant women, you should gather education. You should know about pregnancy. You should know about the things that happen during pregnancy. Okay. You should go for antenatal care. You should not be ignorant. You should save.
Yeah.
You have 9 whole months to prepare for delivery.
For the child.
And then you come to the hospital with nothing, no kobo. Like, you had 9 whole months, you understand? So that's why we are bringing out this health education. We are telling women, be empowered, be informed, because when the chips are down, you are the one on the slaughter table. And so you have to take charge of your life and make sure you make informed choices. Go for antenatal care so that you can identify problems early and bring remedy before they go into complications. We have the trending story about a woman who just died on social media.
Yeah, about the 500K.
Exactly. And you had 9 whole months. The economy is bad, but you should do something.
You should be prepared. Yeah, if you want to bring a child to the world, be prepared.
I don't know. Allegedly, they said she didn't go for antenatal care. For antenatal care. That's where they will pick up high blood pressure in pregnancy. Like I said, is the number 1 thing killing women in pregnancy.
Yeah, you mentioned that earlier.
Is that picked up early, and then this statistics gets eventually reduced. So everyone, men, you should talk to your women, talk to your mothers, your sisters. Everyone should be informed about maternal and child health, and that will go a long way to improve our health indices.
Thank you very much. That is all we can take on this first segment of We Celebrating World Health Day 2025 theme, Healthy Beginnings and Hopeful Future. Yeah. Till we meet again. And yes, Unico 103.5 FM has something special. So don't forget to look out for the distribution of soft care pads across all campus and across the campus today. Thank you very much. And God bless you. Don't touch that down. This is Unico 103.5 FM. My name is Ake Onwada.
Thank you.